All right, so let's talk about cervical checks. Now, if you are a first time mom, the thought of these can really make you just want to shut your legs and cringe. And maybe you're asking, like, does it hurt? And that's a question I get asked by a lot of moms. But for those moms who've had a cervical check, I want to hear it. Like, in the comments, put if cervical checks hurt or what your thoughts are about cervical checks. I would really like to hear it. I want to talk to you today about what a cervical check is, the purpose of them, and some options that you have during labor when it comes to checks. So stick around till the very end for a freebie. But before I go farther, I want to talk to you about what a cervical check is. It's an examination of your cervix to see how dilated and how effaced you are. Now, dilation is how open your cervix is, and effacement is how thin your cervix is. So dilation is measured in centimeters. 0 centimeters is completely closed, and 10 centimeters is all the way open, which is probably around that. Effacement is measured in percentages. So 0% effaced is very thick, and 100% effaced means it's fully thinned out. Now, typically, your body becomes fully effaced before it dilates completely. And these measurements are taken by a nurse, doctor, midwife. They're going to put on a sterile glove, put some gel on their fingers, and then they're going to insert their hand and measure with their pointer finger and their middle finger. Typically, cervical checks start around your 37th week. Depending on your physician, you will get them weekly at your prenatal until you go into labor. The thing about cervical checks is, though, they don't really tell you much. There's little to no evidence for the benefits of performing cervical checks during prenatal appointments. In fact, there was a study done in 1984. It suggests a 3-fold risk of premature rupture of membranes when cervical checks were done weekly, starting at 37 weeks. A benefit of having a cervical check at a prenatal is if you're planning on doing an induction, it can tell you if your cervix is favorable. The Bishop score is a tool. It's used to determine if your cervix is ready for an induction. And the Bishop score checks for cervical position, cervical consistency, cervical dilation, cervical effacement, and where the baby's located, where the station is at. Now, the highest score you can get is a 12. The higher the score, the more likely you will have a favorable induction. The lower the score, the less likely you will have a successful induction. So knowing that score is really important before you decide if you're going to get induced or not. Now, most of the time, a cervical check is done out of curiosity. And just like any intervention done during pregnancy and birth, knowing the benefits and the risk can help you choose what's best for you. So let's talk about what happens with cervical checks during labor. Typically, a cervical check is done on admission to see where you are at, and this is documented. It kind of helps the nurses and providers know if you are progressing at the rate that they think you should progress. And sometimes a doctor will use something called the Friedman's curve to determine if you're progressing or not. Now, Dr. Friedman created this curve in 1955, and it suggested that a woman should dilate at 1.2 centimeters every hour, starting at about 3 centimeters, or she is considered failure to progress or arrest of descent, and then a C-section is done. Now, in 2014, ACOG, the American College of Gynecology, did this awesome thing, and they took a really close look at Friedman's curve. And they changed the standard of labor progression, or they changed the guidelines. Now, active labor is considered starting at 6 centimeters, which is huge, and it really helps reduce the rate of C-sections. This was published in the Obstetric Care Consensus, which is the safe prevention of primary cesarean section delivery. So they say cesarean delivery for active phase arrest in the first stage of labor should be reserved for women who are at or beyond 6 centimeters of dilation with ruptured membranes who failed to progress despite 4 hours of adequate uterine activity, or at least 6 hours of oxytocin administration with inadequate uterine activity and no cervical change. So really, failure to progress and arrested descent should be a term that's used after a very long period of no progression. Now, I want you to imagine for a moment you've been laboring at home for hours and you finally decide to go to the hospital. You're really starting to feel like contractions are coming closer together. You feel good about this decision, and you go to admit, and they want to do a cervical check. So you have 3 options. 1, don't get the check. 2, get the check and ask the nurse not to tell you how dilated or effaced you are. Or 3, get the check and find out where you're at. Now, there's pros and cons to each. So pros of 1, don't get the check. You're not pulled out of your labor groove. There's less risk of infection, and you're more likely to have a physiological labor. The cons of this is you don't know how dilated you are. If you're admitted and you're only 3 centimeters, it can lead to more interventions, a longer time in the hospital, and you wouldn't know if you could go home and labor there longer. So 2, you can get the check and not have a nurse tell you. The pros of this option is your nurse is happy, and because they know the dilation, and you don't, so your nurse can tell you, like if you're progressing or not. You don't really have to risk the disappointment if you find out that you're not as dilated as you hope. Cons, there's more of a risk of infection and increased risk of interventions when you get a cervical check. 3, you can find out what you are. Pros of this is you know and are able to make an informed decision on if you'd like to stay at the hospital or if you'd like to go home and labor more. Cons, your risk of infection goes up and increased risk of interventions. And if you're not as dilated as you think you are, you might start feeling a little bit of defeat. Now, I just want you to imagine that you've been admitted, you're in really hard labor, and you're really having to concentrate and breathe through these contractions. So you've been doing this for what seems like hours, and you're in a really good groove. Like, your nurse comes in, she's like, okay, let's check your cervix. I want you to look at your 3 options again. So 1, don't get the check. 2, get a check and have the nurse not tell you. Or 3, get the check and find out what you are. So I've heard so many times and seen women get a cervical check during active labor, find out how dilated they are, and then they're immediately defeated. They just start believing that their body is broken, that they're not able to handle the contractions anymore. They can't keep going on without medications. This is so common. Like, I see it so often. My own story was much like this. I wasn't dilating as fast as I thought I should be. The nurse had checked me and said I was at a 4, and I had been going all night long. It was about 20, I lost it, and about 20 minutes later I had the epidural, and there was absolutely no way I could keep going knowing that I would have had to dilate to 6 centimeters or more. Like, I couldn't handle it. It took me out of my labor groove. Now, labor is way more of a head game than we even like to believe. When a laboring woman is allowed to go into her own head, relax into each contraction, and find her groove, she's way more likely to get the birth that she imagined. Each check that is done, it kind of takes you out of labor land and puts you back into your rational brain. And so that can really kind of mess up your groove. Now, the second option of having a cervical check but not knowing how dilated you are, when this is done for curiosity reasons, it usually causes more harm than it does good, because if it's done for clinical reasons, it can be beneficial. But to avoid feeling defeated if you're not dilated as much as you hope you are, you can definitely have the nurse check, but just request that she doesn't tell you. And that way you can get right back into your labor groove. So with my second, I had been laboring 4 hours. I have really long labors. And I was showing signs of transition, but I was kind of going in and out of this. So my midwife asked if it was okay with her checking. I consented, But I just requested that she didn't tell me, that she kept it a secret from me. And I am so glad she did, because I was only at a 5 centimeters. And if she would have told me, I probably would have lost it. Instead, I was able to go right back into labor and just let my body do what it was supposed to do. Now, about 10 hours after that cervical check, my baby was finally born. But protecting your mind from disappointment is key into having a natural birth. Now, the thing about your cervix is it's not a crystal ball. There are moms who are completely closed hours before their baby is born. And there's moms who walk around dilated to 4 centimeters for weeks before they have their baby. Things can change really quickly, and it doesn't really give you an accurate picture of when baby's going to be born. So having an experienced provider who listens to sounds that you're making during labor, who watches your body and tracks contractions, it's more reliable in telling you about how long labor is going to be. So the moral of this story, your cervix is meant to stay closed until you're in labor. So those prenatal checks don't tell you much. 2, your cervix can change really quickly or really slowly. 3, you have options. You always have options. And 4, your mind needs to be protected if you're going to want a natural birth. So you are strong. You are capable of making the best decisions for you and your baby. So be the empowered mama you are and choose what option fits best for you. Now, if you're a mom that would like a little extra guidance of what to expect during pregnancy, I have something for you. I'm so excited to be releasing this. It's called the Intuitive Mama's Essentials. It's a guide that will help you on your journey to a blissful and empowered birth. This is a downloadable packet. It's going to walk you through from the time you find out you're pregnant to delivery. There's going to be a hospital bag checklist for the natural mom, a guide of what to expect at each prenatal appointment, so you can look through these options that you have and you can make the best decision, like, do you want this test or do you not? There's questions to ask your provider, affirmation worksheets to really help you dig into what's going on in your mind in regards to your beliefs on birth. I'm so excited about that, you guys. I'm so excited. And then a birth plan template. So I'm just so proud of this, and you can actually get on the wait list for this product, so you know when it's released and when it goes into pre-sale, when pre-order starts. Go to bit.ly/intuitivemama. Get your name on there so you know when I'm releasing this. And it's going to go on pre-order really soon. So make sure you're on that. And then you can also have a chance to win this packet on Wednesday the 18th at 2 p.m. I am having my Blissful Birth Workshop right there on your computer, so you don't have to go anywhere. You can stay in your pajamas or whatever. I guess it's 2 p.m. I don't know. No judgment. I'm in my pajamas at 2 p.m. sometimes too. But to be invited to this private event, go to bit.ly/BBB birth. 4 B's. BBB birth. And give me your name and email, and I'm going to send the invite link to you. So you could actually see it before anybody else if you win this packet. So come join me. It's going to be great. Going to be talking all about physiological birth and how to prepare for a natural birth. So it's going to be great. I'm so excited to see you there. And as always, I'm here for you. I'm rooting for you. Shoot me a message if you have any questions, and I hope you have a great rest of your week. Happy Monday to you. Bye.